ಬೊಂಬೆ ಹೇಳುತ್ತೈತೆ ಮತ್ತೆ ಹೇಳುತ್ತೈತೆ ನೀನೇ ರಾಜಕುಮಾರ. ಬೊಂಬೆ ಹೇಳುತ್ತೈತೆ ಮತ್ತೆ
Whenever NRIs visit Bangalore, we took that opportunity to take them to our units and have grand rounds with them, workshops, conducted workshops, guest lectures, and we had a lot of research proposals, especially from Dr. Vidyasagar. We identified pediatricians who are interested in neonatology at various districts, and we made them to sensitize the fellow pediatricians in that place, and we went and conducted the courses for them. As we were able to save small babies, preterm as well as term babies with various problems, we initiated follow-up clinics. First neonatal follow-up workshop was conducted at Ramaya Medical College. Dr. Nnfk was the chief guest. And ROP, the workshop was conducted at St. John's Medical College by Dr. Swarnareka Bhatt. And we sensitized the pediatricians who were working for newborn at that time the importance of developing neonatal follow-up clinic. Monthly clinical meeting at Bangalore, which focused on common neonatal problems, their diagnosis and management, which became very popular. First we started at St. Martha's because
and all the NNF Karnataka office bearers, previous office bearers, members. I think you people are doing an excellent job, or rather I think we should say we people are doing an excellent job, because I'm also part of Nnfk. I still remember when this was conceived in Karnataka. Dr. Vinod Paul had come on 15th of August in 1990 and casually met me and said, Rekha, will you be a state coordinator for Karnataka for the central NNF? I said, why me? He said, no, we need somebody and I think you're pretty alright for that. And I took on the responsibility, and as usual, after checking with Naresh and saying, Naresh, do you think I can do it? And since then, there's been a great support from everybody, and I think NNF has moved on to great heights, and all the best for the current and for the future office bearers. Thank you.
Dear friends of the NNF Karnataka and dear seniors, respected academicians of the NNF Karnataka, it's indeed a proud moment for me to be honored by the present dynamic executive secretary of the NNF Karnataka in this way. I recall in the year 1994 when NNF Karnataka was formed and Professor Nirmala Kesari was the president, I was a young member of this dynamic and vibrant body, which was even then a very, very vibrant organization. Over the years, I have had the pleasure and proud privilege of being part of this dynamic organization, which was very small to start with, but subsequently now has grown to such a large organization, is possibly one of the best state chapters of the parent body of NNF. I recall about 20 years back, I was the president. Before that, I was the secretary of NNF Karnataka. As a young group of neonatal pediatricians, the members at that time took it upon themselves to spread the cause of newborn care in the state, took on a lot of outreach educational activities, which included CMEs, workshops, and even clinical care in many organizations, including the government organization, with good connection of private and public partnership, which has still been the main force of the commitment of neonatal members of this dynamic organization. I feel at this juncture, the present set of office bearers, including the dynamic president and the secretary, Dr. Prashant, are taking NNF Karnataka in the right way forward. But much more needs to be done. The state government is, of course, very, very cooperative. We need to take all stake members of this organization and also the community and also the state to try to see if we can achieve single digit mortality for newborns in the state of Karnataka. It is quite possible with the commitment already shown by all our members, and the dedicated, combined and coordinated efforts of our members should be able to achieve this. Proud of this organization. Long live NNF Karnataka. Happy to be part of this organization and very, very happily willing to do anything for NNF Karnataka. Thank you so much.
Good morning. I thank President National Neonatology Forum Office Bearers Dr. Kosuresh, President, and Dr. Prashant Gowda, Secretary, for remembering us as a past President. Most probably third or fourth, I cannot recollect. Those were difficult days. The neonatal care was still in.
Nnfk Karnataka as well as the central Nnfk for the past almost 25 years. And then here in Bangalore, we had Dr. Maya, Dr. Subbarao and Dr. Swadareka, but were all pillars of Nnfk Karnataka, and with their guidance and support, we could continue for quite some time. I was the president of Nnfk Karnataka between 2005 and 2007. And the main thing at that point of time was we conducted a seminar, CMVs, and then quiz exclusively for nurses. For the first time in the history of Nnfk Karnataka and Central Nnfk, we conducted quiz and CMV for neonatal nurses. It was very well attended, and we had very good number of speakers as well. Another important part of this 2-year journey as a president was we had Dr. George Simbruner, a professor of neonatology at University of Innsbruck and the founder of Hippocrates, who delivered 2 lectures here in Bangalore. That was another hallmark of our tenure as president. Thank you once again, Dr. Koturesh, Dr. Prashant Gowda, and the team NNF Karnataka for felicitating the previous office bearers. Thank you very much. I wish you all the best.
My first love with NNF is through state chapter. After I returned from abroad in 1996, I became a member, so it's roughly about 25 years now I have been a member. I still remember Dr. Maya and Dr. Swadareka and Subbarao used to hold the meetings in Martha's Hospital. Then it moved to Bowring Hospital Auditorium, and after that in various other venues. It started as a small family, and now it has become a vibrant, large organization. So the seeds which were sown at that time has developed into a beautiful tree. I, as president of NNF Karnataka, did my best. We had 2 conferences in Kolar and in Bangalore. I had an able secretary in Dr. Suman Rao. As first president from Karnataka of the national NNF, I would definitely want Karnataka to have quite a lot of prominence in all the activities and in all the projects of central NNF. I know this year's NNF National Conference has been postponed, but it has been awarded to Karnataka, and we definitely will have the conference at the end of the year, I hope. And it would be my proud moment to stand before my own colleagues and my own co-members as president of NNF India. NNF Karnataka has always been in the forefront of activities. It is one of the earliest members of the National Neonatology Forum, earliest chapters, and all along it has been an ideal member with lot of innovative projects. Please remember, Bangalore in Karnataka has been the NNF hub for many decades now. I wish Karnataka NNF all the best, and I commend the idea of acknowledging and felicitating the past presidents. Thank you.
It gives me great pleasure to know that the National Neonatology Forum Karnataka State Chapter for 2020 has come out with a brilliant idea of having a founders meet on the coming Sunday, 27th December, on the eve of initiation of NNF network in the state of Karnataka. I really feel privileged to work under Dr. Nirmala Kesari, who is the founder and president of NNF Karnataka state chapter. She was my mentor, my teacher, and she is the driving force to start the newborn care in this part of the country. When we started working in the 90s, the neonatal mortality was unacceptably high, to the tune of 60 to 80 per thousand live births across the country, though it was little better in Karnataka. So at least in Karnataka it was around 50 to 60 per thousand at that time. Friends, after 30 years, it's so satisfying that according to NFHS 5, the neonatal mortality rate of the state of Karnataka has dropped to 16 per thousand live births, and we are marching towards achieving a single digit NMR, latest by 2026 and 2028. What a happy moment it will be when we see Karnataka listed as a state to achieve single digit neonatal mortality rate. Friends, my teachers and my junior colleagues, we have learnt a lot working with our great teachers, Dr. Swarnareka Bhatt, Dr. P.P. Maya, Dr. Shantaram Baliga, Dr. Vabira Bhadrappa, many to name, and they have contributed immensely for the betterment of the newborn health. I only appeal to all my colleagues and my junior friends to be humble, humane and honest. Everything, be pride, be academic brilliance, publications, popularity, money, everything will automatically follow. I see currently people are in a hurry. We need to reach the unreached in the state of Karnataka. We have conquered, we have wonderful units in big cities and district hospitals, but we need to strengthen the services in the remote areas. It's a pleasure to see that asphyxia, acronym aspiration syndrome, and to a great extent very bad septic newborns, the prevalence has come down significantly over decades, but we are seeing new threats of extreme prematurity and their follow-up problems that we are encountering. With this, I wish the NNF all the success. Our vision should be to reach a single digit neonatal mortality and join hands to the success of India Newborn Action Plan, which is a dream child of the current central government of India. Thank you very much for your patient hearing. Thank you.
Thank you, Dr. Ali. Thank you, Dr. Abhishek, for this kind gesture. I must thank all the office bearers of NNF Karnataka who are part of this kind gesture. During those 2 years, we digitized the membership, communication was started, email address list was finalized, new member initiatives were taken, and more importantly, we had fulfilled all the statutory requirements to run a society, especially the registration under Societies Act, and we need to submit the report every year about the society activity. Both years the conferences were conducted, one at Mangalore, the other one at Chitradurga. Those 2 years saw a very good relationship with Government of Karnataka. We took many initiatives to start, initiated the process of evaluation of SNCUs, mentoring of the NICUs, and then we also wanted the government to come up with the Karnataka Neonatal Action Plan. The seeds were sown during that time, and subsequent office bearers have taken it to a meaningful end, or rather continued it further and hopefully it will continue in future days to start with NICU at medical colleges. So those were very beautiful years of organizational work.
ಅದಕ್ಕಿಂತ ಮುಂಚೆ ನಾನು ನೋಡಿದ್ರ ಪ್ರಕಾರ ಒಳ್ಳೆ ನಮ್ಮ ಸೀನಿಯರ್ಸು ಇದನ್ನು NNFನ ಒಂದು ಸ್ಟ್ರಕ್ಚರ್ ಅಂತ ತಯಾರು ಮಾಡಿ ನಮ್ಮ ಕೈಗೆ ಕೊಟ್ಟರು. ನಾವು ಅದರದ್ದು ಒಂದು ಋಣನ ತೀರಿಸ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಮಯ್ಯ ಸರ್ ಆಗಲಿ, ಸ್ವರ್ಣರೇಖಾ ಮೇಡಮ್ ಆಗಲಿ, ಇವರೇನು ಮಾಡಿದ್ರು ಕೆಲಸನ, ಮತ್ತು ಉಳಿದು ಎಲ್ಲ ಪ್ರೆಸಿಡೆಂಟ್ಸ್ ಏನಿದ್ರು NNFದು, ಆ ಸಮಯದಲ್ಲಿ ನಿಯೋನಾಟಾಲಜಿ ಅನ್ನೋದು ಸರಿಯಾಗಿ ಗೊತ್ತಿಲ್ಲದ ಸಮಯ ಈ ಮೆಡಿಕಲ್ ಫೀಲ್ಡ್ನಲ್ಲಿ. ಸೊ ಅಂಥದ್ರಲ್ಲಿ ಅವರು ಇದನ್ನು ಒಂದು ಡೆವಲಪ್ ಮಾಡಿ ನಮಗೆ ಇದನ್ನು ಕೊಟ್ಟಿದ್ದಾರೆ. ಸೊ ಆ ಸಮಯದಲ್ಲಿ ಏನಿತ್ತು ಅಂತಂದರೆ ಲೀಡರ್ಶಿಪ್ ತೊಗೊಳ್ಳಿಕ್ಕೆ ಲೀಡರ್ಸ್ ಜಾಸ್ತಿ ಸಿಗ್ತಿರ್ಲಿಲ್ಲ. ಬಟ್ ಈಗೇನಾಗಿದೆ, ಏನು ನಮಗೆ ವ್ಯತ್ಯಾಸ ಕಾಣಿಸ್ತಾ ಇದೆ ಅಂತಂದರೆ, ದರ್ ಇಸ್ ಅ ಲಾಟ್ ಆಫ್ ಯಂಗ್ ಬ್ಲಡ್ in this organization, and lot of activities are happening, and neonatology simultaneously is increasing in its capacity and its results, and thus now NNF Karnataka has become a very solid organization and has made a very good name at the national level also. And I congratulate the current office bearers and all the young neonatologists who have been responsible for today's name and fame of NNF.
Singapore, PK Women's International was the star speaker. As an executive member in 2016-18, got registered NNF as a society and got its official PAN number. During presidential tenure, NNF account, auditing and financial stability was brought. Started SINCU mentoring. 41 SINCU mentoring was done in association with Government of Karnataka Health Department. Under district and presidential action plan, perinatal action force was started, and accordingly memorandum was submitted to Secretary of Health and Family Planning. The purpose of this action plan was to have a perinatal audit committee in each district, all over Karnataka. As a NNF president, successfully conducted NNF conference at Vijaypura consecutively 2019 and 2020. An eminent faculty from all over the world came to Bijapur, city of gold numbers. Future vision is to set up perinatal task force at district place with the government, in association with the government bodies, in association with NNF, FOXY, IAP, in association with Government of Karnataka Health and Family Planning Department. Injection vitamin K, audit and accountability, audit and accountability administration at each private and government center to prevent morbidity and mortality related to late SDM. To establish district level NNF branches all over Karnataka, already Vijayapura, Hassan have formed the district level NNF committee. Our vision is to have NNF should have its own building to continue its academic activities, continue community activities, to benefit the community activities in association with Government of Karnataka Health and Family Planning Department. Thank you.
Dear members of NNF, seniors and friends, as aware, we are conducting webinar series since beginning as Corona created a lot of problems. When NNF activity started, we started the NNF activities through webinar series. Almost 189 programs have been conducted. So through this webinar, we have conducted almost all the programs including basic newborn care, ventilation, oxygen, hypothermia facilities and even ultrasound facilities also. Amongst all, we are Founders Day we are celebrating on this after 30 years of NNF activities. So we are getting all the information from past pediatricians, experiences and contribution to the NNF activities. And lastly, we are also extensive programs have been want to spread throughout Karnataka, not only at the periphery. Each and every baby has to get the essential program and well-being of things have been taken out. Our main motto is to prevent newborn mortality. We want to create atmosphere so that newborn death rate should become zero. And with all the things, our secretary and treasurer and past presidents and as well as vice presidents and senior colleagues, we have created a lot of activities through North Karnataka and South Karnataka, including all the zones. EB members and executive members have created a wonderful atmosphere of newborn care. And let us hope, I am proud to say that I am in president activities, these things are happening. Though we are not conducting person-to-person contact, through webinar we have been conducting newborn care well in this Karnataka. And I would like to continue with this all my colleagues. Thankful for all the colleagues who have been supported to the activities in Karnataka. Good day.
And we are live.
Hello, all my fellow colleagues. Proud to be a part of celebration of the founding day of NNF. I am happy to connect to all my colleagues on this virtual platform to put forward my experiences and views on neonatology. During our period at the helm of NNF Karnataka chapter, we stress more on preventive aspects in neonatology, proper maternal nutrition, good conduct of a hospital delivery. This is simple and yet a vital cog in the wheel information. We were able to disseminate this information to the micro interiors of Taluka hospitals and PSCs. We trained the nurses and other paramedical staff attending the newborn in basic resuscitation and life support. We stress with all vigor for proper neonatal outcomes. Nowadays, we need to stress on neonatal screening of various diseases which can help in preventing morbidity and associated mortalities. So I wish the NNF.
I have been associated with NNF Karnataka since 2005 and I think it has made great progress in the past 15 years. Initially, I think it was more an academic body, but now it has taken up its responsibility in a much bigger way and we are supporting the government, the SNCUs, the mentoring which is something that has happened in the past few years. I think we are very proud of it and I hope it goes a long way. I do believe that NNF Karnataka has a big role to play in improving the outcomes of the newborns, not only in Karnataka but also globally, because NNF Karnataka has produced many leaders at the national level and I'm sure it will continue to do a great work. Thank you.
NNF rightly has done this to facilitate
such great teachers, because teaching the neurology is such a you can say business oriented now. Anyone can practice medicine with making lots of money, but we should have such great teachers who are there in the institution and making postgraduate level teaching a better thing for you all to learn, and then inspire others also to take up neurology branch in the due course of time. So I think that is a very great thing for us, and it's my privilege to be able to be illustrating my teachers. Thank you.
Come now, sisters. Come, stand here. Come. Bring your mask. You can ask. Quickly stand up. Come. Deepak, Sunita, come. Annapurna is covered. This side.
Ma'am, you are not coming the frame.
I have been proud to be a member of Nnfk Karnataka and to have contributed to it in several capacities as a secretary and an EC member. Nnfk Karnataka was a small organization when I joined, and it has grown so much, and now it has come together in a beautiful way. I'm happy to see and I'm proud to see Nnfk Karnataka doing so much work and contributing so much towards the welfare of the newborns. I will continue to work towards newborn healthcare alongside Nnfk Karnataka. Long live NNF.
Good evening, friends, and thank you very much for the current NNF office bearers for giving me such an honor. It's a real privilege. I joined NNF in 2012-2013, and it's always been a great journey so far. NNF Karnataka has been the passionate thing for me, and NNF India, of course, the motherland, one of the main reasons to come back to India to serve our country. And I've been really fortunate to be the secretary of NNF Karnataka, and I'm really proud of whatever we have done. Every office bearers always come with an intention of one thing: give their time and do something very good for our newborns. First, we'll start with our local place, our own district, our own state, and then we move on to the country. So I think that has been the motto for all the NNF bearers, and that has been pretty much my motto. and I still remember the SNCU evaluation during my time with the support of all the people, which has been a great success. And the success story continues previous to me and also the current office bearers. They're doing a fantastic job, and I hope every year or every 2 years, whenever the new office bearers take up, they keep doing a great job, so that main aim should remain that our mortality in our country should reduce. Second thing is the survival of those children with the intact survival should be good. These are the two main issues, and we continue both training, we continue our research, and we continue our day-to-day clinical work with to full heart. So Jai Karnataka, do very well. Thank you.
Thank you. NNF, the inspiration for me is that obviously my passion is newborn care, and my professor Dr. Baliga has always been actively involved in neonatology forum. Since I come back from UK, directly I started working with NNF and realized that the goals of NNF, which is mainly for promoting the newborn health in public as well as private sectors, involving our own members, how do we kind of collaborate with everybody and contribute to improvement in the newborn health. I try to do my best during my time as secretary and treasurer of NNF Karnataka. I will continue to do my part in this great organization, and we all should be focusing on newborn health and try to make it like a teamwork and improve the quality of the care for the newborn. Thank you.
Yeah, hi, I'm Dr. Prashant Gowda. I'm the secretary for NNF Karnataka State Chapter for the term 2020 and 2022, 2 years of term. First, I would like to thank Dr. Kotreshi sir for making me secretary during his tenure, and we have taken up the office from March. That's a time when the world got hit with pandemic, and from the time we have taken over, we always had a vision that we would want to bring out the NNF activities across the state, and to do that it is not possible for one person, but we need a team, we need a brigade, we need a lot of good hardworking, young, dynamic, with a blend of the advice from the seniors, and that's the reason why we expanded our cabinet on NNF office. We had 15 executive board members trying to get representation from all across the state, and we made 6 joint secretaries so that the responsibility will be equally divided across the state. The most important thing with this particular vision as an NNF state secretary was to involve the representation, was to involve the entire Karnataka, every district, 31 districts of Karnataka, so that we have NNF representation from each and every district, and that helped us in getting probably in the history of NNF Karnataka, in a year we had more than 100 NNF India lifetime members we were able to do, and we were fortunate enough to have a very good coordination from entire Karnataka, not only the state, even entire India, and even outside India we were able to get good support when we started doing our academic activities. And we didn't know, and we didn't had any expectation that we would break records in terms of conducting academic activities, and we were fortunate enough with the good support of entire state. We were able to conduct almost 189 webinar topics with having speakers from both nationally and internationally, attended by more than 100 to 200s, and we had a record of almost 500, more than 500 delegates attending our webinars from all across the country and even outside the country. And as a secretary, our vision was one was to strengthen the office, one was to increase the NNF membership, and academic activity, focus on the academic activities. So far in 1 year, we were able to accomplish. At the same time, we have a vision for the coming years and to set a goals and to set a targets for all of us, the upcoming office bearers, as well as each and every NNF members who are there, so that they make the neonatal care in newborn and take it to a next level. So we are now getting into the SNCUs across the state, not just mentoring. We really want to bring change by getting them equipments, by giving them a lot of support, not just the one-time support. We want to give them a constant support. So we were planning to bring in a stable supporting team, volunteers from our neonatology pool, from NNF Karnataka members pool, so that we create a difference. And we always, we want to complement our doctors across the state, especially the rural areas, so that they are not left around. We are always there. And NNF Karnataka, in association with UNICEF, in association with Foxy, during the COVID time, we were able to release a COVID protocol book, which has been quite handy. And this book has got phenomenal support. And we were fortunate that our Honorable Chief Minister of Karnataka, Shri B.S. Yediyurappa ji, released our book, and we got a good support from our obstetric part as well, from Foxy, from Kasoga, BSOG, and UNICEF. So it has been a good journey so far, but we are not done yet, because health is always a dynamic thing. We need to constantly keep pushing ourselves to reach the best health indicators. We cannot work for any appreciation. We should work actually for the care of newborn, and that is what we are trying to do. We are trying to do our best, whatever we can, and we will definitely will take up our newborn care in Karnataka to a different level. So I expect a continued support from all of you, and we together can definitely make a difference in the coming days. Thank you.